Let's talk about climate resilient wash and healthcare facilities. Healthcare facilities require wash services to perform essential functions like infection prevention and control. Imagine then how climate change might impact the availability and quality of wash services. Too little water would mean that healthcare workers can't wash their hands and cleaners are unable to disinfect surfaces. Too much water may overflow latrines, spreading fecal waste around a facility filled with sick patients. Either way, climate change is impacting the quality of care provided within the facility. But to fully understand climate resiliency and wash and healthcare facilities, we first need to better understand how the health sector is addressing climate resiliency. And this is useful to look at the WHO guidance for climate resilient and environmentally sustainable healthcare facilities, which says these facilities anticipate, respond to, cope with, recover from, and adapt to climate-related shocks and stresses, while minimizing negative impacts on the environment and leveraging opportunities to restore and improve it. What does this mean in practical terms? It's really two sides of the same coin. First, climate resiliency is that the facility designs are risk-informed so that the healthcare facilities can deliver care with minimal disruption despite acute or protracted climate events. The other side of the coin, which we won't talk about today, is environmental sustainability or greening, which is the idea that healthcare facility operations do not exacerbate climate change further. When we look at the climate-related risks that impact the healthcare facility, it's useful to break these risks down into three components. First is the hazards, and this is what's actually directly impacting the facility. This is the climate shock or stress, such as floods, storms, and droughts. This will have an impact on certain exposures within the facility, such as water, sanitation, and waste services. The extent to which the hazards affect the exposures is dictated by the vulnerabilities, which would be social, economic, demographic, environmental, and such. Think of the vulnerabilities as a knob you can turn up and down. Together, these risks will have an impact on the healthcare facility and how resilient or not resilient the facility is. So you think about the normal performance of a healthcare facility, then climate change will have either a stress or shock that causes a drop in performance. And the extent to which the performance dropped is dictated by the risks, the hazard, exposures, and vulnerabilities. So when you're talking about climate resiliency in healthcare facilities, the goal is to reduce the amount at which the performance drops and minimize the amount of time it takes to recover. So in an ideal situation, a healthcare facility would recover to pre-event state or even recover better than before or transform, thinking of the idea of build back better. In a less than ideal situation, the healthcare facility's performance would drop, it would recover, but it would recover to worse than before, or in the worst case scenario, the climate stress or shock would be so extreme, the performance drop would be so much so that the healthcare facility collapses entirely. So WHO has put together these requirements for providing safe and quality care in the context of climate change. And what's really critical for WASH colleagues to understand is that WASH is one of the four key pillars. So when we look at this, there's health workforce, energy, infrastructure, technologies, and products, and then water, sanitation, hygiene, and healthcare waste. It's not just the health sector that's talking about climate resiliency. There's also a conversation going on amongst the WASH sector, and in particular, looking at climate resilient development. Here's an example of a resource from UNICEF and Global Water Partnership that is looking at similar things of the climate effect, the hazard, and the impact on the WASH sector. It's useful to also take this lens to think about how the healthcare facility sits in a larger ecosystem and what efforts are being undertaken to address the resiliency of WASH services more broadly. So once you're ready to address climate resiliency in WASH and healthcare facilities, there are several tools and resources that can help you guide this process. The most important of which is the WASH-FIT tool, in particular WASH-FIT 2.0, which was published in April of 2022. And this tool takes you through the steps of improving the healthcare facility through the 5-step model. And throughout that process, there is recommendations on how you would integrate climate resiliency throughout this, including a number of indicators on the assessment tool that link back to climate resiliency. So this is a really critical tool and one worth looking at as you approach your own climate resilient WASH and healthcare facilities programming. And once you've taken a look at the broader ecosystem and understand the type of needs and risks that you'll need to address, then it's time to think about interventions. And it's critical to recognize that it's not just one action you'll take to make your facility climate resilient. Instead, a tailored plan will be needed based on the identified risks. There may be recommendations for water, looking at water quality and storage, recommendations for sanitation to ensure that the toilets don't overflow, or recommendations for hand hygiene, for example, to ensure the facilities don't leak. There may be recommendations for now, and there may be a need to continue to adapt the plan as further climate risks affect the healthcare facility. Now, with this basis of understanding on climate resilient Washington healthcare facility, it's time to hear from those who are already implementing this work to think about how we can learn from them and take these recommendations forward.
Here, I'll be sharing some of the effort that towards climate resilient Washington healthcare facility, keeping in mind the flooding in the project locations. You could see the red circle area, which is one of the highly flood-prone area in Nepal. So this is basically the water treatment system in healthcare facility. You could see that we have installed water treatment system at the first floor of the healthcare facility, and you could see the left hand side that we have water tap which is raised, so that the facility or patient, they can collect water from there, which is, I think, in case of flooding as well, that they have access to. We have ensured that the health facility and the patient, they have access to safe water. So these are other example where I mean, this is something that we have put in place this May, June to September. There's a rainy season in Nepal, so there's a high chance of flooding. So we actually worked with the healthcare facility that to ensure that the septic tank are regularly being emptied during this period, and the construction of toilet in the location within the healthcare facility. Either they are raised toilet, or we identify the space where they have less prone to floods. And third one is particularly a distance between the toilet and water sources. So this is some intervention that we are doing. Besides that, regular cleaning of toilet is also kind of very important in this kind of situation. So this is something, I mean, some recommendation that based on our learning, we need to have some supportive policies and guideline that will help us to have climate resilience infrastructure, capacity building of human resources, and developing regular maintenance of waste infrastructures, and emergency response plan. So I think that if we have that, most of the healthcare, they are lacking this. So if we have that, I think that will help us to deal with this issue and promote climate resilience in health programming. And definitely the last one is climate resilience building, waste facility and budget allocation things. So these are some of the recommendations based on our learning from Nepal.
We registered success in 6 healthcare facilities, but when we went to another district called Pader, we hit a snag. Mostly, we found very interesting challenges. And so we had challenges of dry wells, and when we tried the swamps were also dry. So we needed to do something. So we held community dialogues with the communities. We brought on board people from the district, community, elders, to assess what the actual problem was. We identified certain risks. And like I said, one of the key risks was the drying of even the deep wells. So we developed action plans with the communities to resolve this water problem. Then what we did is we identified solutions. But then our meeting point was always the healthcare facility. There's nothing that is such a turnoff than a sick person going to a healthcare facility and they can't access water. So that turnoff was also motivation enough for communities to want to do something to make sure there's water at the healthcare facility. When we did all that we did, the swamps are not recharged immediately. After the first rain season, there was no recharge. But the district had helped us to create a bridge that was connecting one side of swamp to another. So after 2 rain seasons, the swamp got recharged. We also had a shallow well that people were so sure had just dried up because of water. And so after 3 rain seasons, that's like a year and a half, the shallow well recharged. Then we're also now able to pump water to these 2 healthcare facilities. Our recommendation is that it's very important to involve the front bearers of climate change, that is the women, in programming, so that the indigenous solutions that they are used to become a foundation for new solutions. Otherwise, I mean, we are the ones who are supposed to implement these solutions. They won't make sense to us as women. And since we have youth making over 70% of the population, unless we make interventions attractive to them, maybe thinking digital, then we are speaking to the elder people, but then the 70% of the population, these things will not make sense to them unless we make it make sense to them.